Good evening. Hi, this is Dr. Rodiales from the Atlanta office. And today I want to talk about some new techniques that are out there for women past 40 with decreased ovarian reserve. As some of you know, it's an area of interest, and I wanted to always try to look for new alternatives for you. Understanding that donor eggs are always going to be there, and it's an alternative that is as honorable as trying to use your own eggs. So let's talk briefly about the history of rejuvenation cell therapy and trying to use our own biological abilities to heal. As some of you know, some of this started probably about 50, 60 years ago with the use of PRP or platelet rich plasma. And at first, the one of the first groups of doctors to use it were the maxillofacial surgeons to try to avoid rejection of implants. They realized that they were using not exactly PRP, but platelet-rich fibrin, so something a little thicker with more coagulation factors in it. And they had such good responses that eventually the orthopedic doctors picked up on it. It started spreading through different areas, including cosmetics and pain management. And eventually it found its way into fertility as a way to do ovarian rejuvenation. The data was greatly it came mostly from Eastern Europe, from Greece, but it raised in popularity very quickly. And it has become a very good tool within the United States and outside, and is pretty well recognized. Of course, none of these techniques, it's 100% guaranteed, just like any medical intervention, but the results are promising. I personally have been using it for over 12 years in my practice in different areas and had wonderful results. But what happens if PRP is not enough? So then research started on stem cell therapy, both from our bodies as well as exogenous or somebody else's body. And this research started about 25 years ago. At first, they started playing around with embryological tissue. They realized that besides the ethical component, that it comes from embryological fetal tissue and what that poses. One, it caused a lot of rejection because the embryological cells will have the signature proteins on its surface that distinguishes as a foreign individual. And then the second issue was that, yes, there was the potentiality of being anything, including cancer. So they realized that embryologic tissue was very prone to create tumors. So that died off very quickly. Then they started looking at the placenta and placental tissue, amniotic fluid, the cord, and they realized that that was disposed of gold. There's a reason why nature animals eat their own placentas, because they're very, very rich in growth factors and nutrients. But also it has an anti-aging effect. And again, being the equivalent, right? The placenta is the same age as the embryo. And because of its natural, the way it works, the physiology of the placenta, it is a buffer between the mother and the fetus. So it does not want to be recognized as foreign. So it does not elicit the signature proteins on its cover, okay, on its cell membrane that will be detected by the mother's immune system as foreign. So the rejection is near to zero. It's not zero, but it's near to zero. So research on placental stem cells started being used. Also, it was not totipotential. So some of the risk factors of cancers were eliminated that way. and it started being used in chronic diseases and cancer adjuvant therapy, and more recently in fertility as a mean to help women with low ovarian reserve or recurrent miscarriages. I have been blessed to be using such a technique for the last 2 years with very promising results, especially on the extremely low ovarian reserve. Okay, I would say that in the low ovarian reserve crowd, in the last few years, I realized that you cannot treat everybody the same. I know that by definition, low ovarian reserve is considered any AMH under 1, but even that, it has gradations. And I would say an AMH of 0.5 to 1, it's one group. Okay, then 0.5 to like 0.3 is another group. 0.2 and below becomes a separate group. On that group, I've seen in my experience, PRP does not work as well. And that's where, foreign stem cells imagine you're bringing an outside battery to resuscitate the ovary. So foreign stem cells seem to be very, very promising. So I would say from like 0.1 to 0.3, I've seen great, amazing results with foreign stem cells. But what happens if that doesn't work, right? None of these techniques are guaranteed, and you don't have the desire, or you're not ready to jump into donor eggs. And like I said, that's a very honorable choice, but you as a woman have to be ready to make that decision. And I can totally understand that, being a girl myself. So there's a new technique that is going around. It's fairly new. The research started in the 1980s. And it was mostly on mitochondrial diseases that were lethal. They started experimenting, extracting mitochondrial from healthy cells and injecting it on cardiac muscle of very diseased people, to see if there was a healing process. And they realized that they were able to not eliminate the disease, but prolong the life of these patients and improve the function of the heart muscle and the quality of life. So fast forward, the research that happened back then to, its applications in fertility. And then they started saying, okay, what if instead of trying to help these people once they're already out of the womb and adults, and they already have all of their cells messed up and they have a condition, what if we can treat them pre-conception, right? Or early on in the conception, and try to, minimize the consequences of having such a disease. And then they started injecting this mitochondria into the embryo, and realizing that being stronger than the diseased mitochondria, they would multiply and almost 100% take over. And so that's where it all started. The techniques have improved, and that one, because it's not as clean, it's not longer used. There are two techniques that are being used in Europe right now, which is the maternal spindle transfer and the pronuclear transfer. And what are the differences between these two things? The maternal spindle transfer, essentially you have a healthy donor egg and a disease egg, okay? Because remember, we're looking at anti-aging in this forum, but this started to try to prevent mitochondrial disease on the baby. So diseased egg, healthy egg, and what they would do is remove the nucleus from the the sick egg and put it into the healthy egg. So take out the healthy nucleus and put the donor nucleus inside the healthy cell, and then proceed with regular IVF. Okay. And then the second technique is the pronuclear transfer. They would take the diseased egg, the healthy egg, fertilize them with the father's sperm or the donor sperm, and then take the desired nucleus from the embryo, okay, into the healthy embryo, all right, and then the DNA from the healthy embryo, it gets discarded. Those two techniques are still, used in certain parts of Europe, and now it's being offered to other ladies, and that's where it gets interesting for some of us, right? So why is that somebody that's in their late 40s, maybe even early 50s, have issues with their eggs? They might be normal eggs, right? You might not be making a lot, but you still might have some really good eggs in you. However, the DNA in the nucleus might be normal, but the cell is weak, right? It's weak, it's older. So your mitochondria are the same age as the rest of you. And it might not be strong enough to sustain the process of fertilization and multiplying, etc., because the mitochondria from the mom is the one that feeds the embryo and eventually the fetus and so forth. Okay, sperm have very little mitochondria, just enough to give the sperm energy to get to the egg, and then boom, it's gone. You are 100% mitochondria, maternal mitochondria. Okay, so if you have an older egg that might be normal, like nuclear wise DNA might be normal, but does not have all of the other components healthy enough to sustain all the process and the energy required to create another human being, that's when you get into either early, the egg might fertilize but die early, or early miscarriages, etc., etc. But why, if we can give a super powerhouse to that nucleus, so the same DNA that would, make that baby look like you on a 20-year-old egg. So boom, they've realized that some of these women that have had their multiple failed IVF or tons of biochemicals, early miscarriages, they end up having a baby using some of these techniques. Of course, there's a lot of controversy around them because now they talk about it as a three-person baby because it's going to have DNA from mom and dad, and then mitochondria DNA from the donor. But then again, we're already messing around with PGT testing, and we're already playing with genes anyway. So, but I'll be respectful. It is controversial. And the other thing that's controversial about it is that the best of the two techniques that I just described, as you can imagine, is actually transferring from the desired embryo to the healthy embryo and discarding the embryo. And in some cultures, a fertilized embryo is already a person. So there's a little bit of controversy on that area as well. So I wanted to update you on what's out there in alternatives. I know it's not doable on this side of the world yet. I don't know if it will. They might. Stem cells, exogenous stem cells, are also not allowed in the fertility arena. There's some other techniques out there. We can talk about the very small embryologic light cells, which do come from you. That's another buzzword that's very, very young, especially in this arena. But I believe that as long as there's life, there is hope. And this process, all of it is, therapeutic as diagnostic. And we discover new things about our universe and our biology every day. So you never know. And like I usually tell my ladies, yes, you might be 45 and we have to, change the way we perceive this whole fertility thing. Donor eggs are always a choice. Again, it's not the end of the, it's not the end of the world as a lot of us think about it. It is a choice that's there. You have to be ready to make that transition, and you should be allowed to make that transition on your terms. But if the worst thing that could happen to you is have a baby with 100% donor eggs, it's not that bad, because the end goal is to have a baby. And at the end, it's your baby. You're going to be peed on, puked on. You're going to be pregnant and miserable like the rest of us get to be. And once you have that child in your hands, the last thing that you're going to think of is where the egg came from. All right, guys. Well, as usual, it's always a pleasure to meet with you. If you don't have any questions at this time and they pop a little later, you're always welcome to reach out to me, to the Atlanta office or to Restore Health. The phone number to the CNY side is 770-266-3930. That will be connected to the main line. The back line or the supplement store is 770-266-0933. You can also reach out through social media. And I will see you guys in about 2 weeks. Bye-bye. Have a good rest of your evening.